Good afternoon. Thank you for joining us. Today's webinar is Preventing Mental Health and Safety Crises through Critical Alerts, Proactive Communications, and Anonymous Reporting. A few logistics before we get started. All phone lines except the lines of the presenters are muted and will remain muted throughout the duration of the webinar. All questions will be fielded using the chat feature. Please take a moment now to locate the chat box on your screen. If you don't see it, click on the chat tab and it should appear. Although you may have questions for a particular presenter, we ask that you send your questions to all panelists in the pull-down menu. Type in your message and then press send. We encourage you to post your questions as they arise. We're recording today's session to share with all registrants and members, and we will send out the presentation recording to everyone who registered. Without further ado, I'll introduce Melissa Vazquez, Vice President of Client Success at K12 Insight.
Yeah, good morning or afternoon. I guess maybe it's afternoon in all time zones at this point. So happy that so many of you can join us today for this so important topic. And we are also very pleased to announce that we'll be joined by Kelly Gradstein, the Assistant Director of Student Welfare and Success at Temecula Valley Unified School District. We'll be hearing from her in just a moment. She'll be sharing some of her journey and some of the story that is relevant to this topic that's been happening over at Temecula. And so you don't want to miss that. And if we head on over and get our presentation started, we will see. I wanted to kick it off with a couple of stats because Kelly's story is really powerful, and it's one that I think brings it home to just one district, right? And helps us really understand the magnitude with a bit of a personal flair. But before we do that and hear that, there are some stats that we rounded up around this issue of mental health. And I have one of them up on screen. And it says there nearly 1 in 3 parents say their children's mental health is worse now than it was before the COVID-19 pandemic. I want to highlight this one because this is not new because of COVID. Mental health has always existed. It's always been something that we've needed to support in our schools across the nation. But we are seeing some of the stats that I'm going to read to you indicate and reflect that COVID has exacerbated some of the things that were already there and have made them even more present than ever. So a few that we found interesting is a poll that was recently done by this one here in particular was done by the Kaiser Foundation. And the Kaiser Family Foundation is a trusted source in gathering up this information. So it's not looking at any one area in the nation, but this is nationwide. Another interesting and alarming stat that is out there is that in 2019, 1 in 3 high schoolers, talking high school specific at this point, reported persistent feelings of sadness or hopelessness. And that number is high, but the alarming thing I think is that we saw it was a 40% increase since 2009. So it's this trend of things of the sadness, the depression, the different areas of mental health. The increase is what has really caught our attention here at K12 Insight, and how are we and how are our tools working to make a difference and do something about it, because sometimes it's paralyzing when you see these stats and it feels almost hopeless to go and read something like that. But that is what I think is really, really powerful about the webinar we're bringing today. We're going to have an example of something that's being done about the stat. It's not just a stat and that we can sit and revel in the magnificence of it, but we're actually going to talk about some actions. I also know that, personally, having my own school age children, some of these things that we're seeing out in the news, they worry me from a parent perspective as well. And as a former school leader myself, that's just another area where you're in charge of so many families, precious students. So before we jumped in and actually heard from Kelly, we wanted to do a little poll and hear from you, because we know that if these are some of the stats that are out there, This is the highlight of our webinar today, that you have some of these crises on your mind too, and putting, they're all, as you see the poll come up, what crises do you fear most in your school district? Naming just one, I'm sure, is hard. But we did make it as a singular pick list so that we can see if one of them rises up to the top, and if there's a theme amongst those of you that have joined us today that we can center on. So we'll take about a minute or 30 seconds to let you all answer that poll and get it to be a little bit more interactive so that we can tailor some of the content to some of the areas that you're most worried about. Okay. Take a few more seconds to give you time to answer that poll. And I see some attendees are still popping in. We'll have another poll later on in the end too. So if you weren't able to catch this poll this time, we will be doing another poll. So keep your eyes out for the additional poll. And the results are in. Okay, this is actually really helpful, Kelly. And I think we're going to see that what we have put together is kind of where we thought this would rise to. And we see that suicide attempts with students and or staff members is the number one that from our audience participation. It's going to dovetail really nicely into some of the things that Kelly's going to talk about is they're doing over at Temecula Valley. And not far behind that is, of course, the school shootings. We have the student death. We have some other natural disasters and fire. Nice to see that bomb threats didn't make the list, but I'm sure it's still out there. And there's been a few of those across the nation this year. But suicide attempts, students or staff, this will pair really, really nicely. So thank you so much for participating in that poll. And I do want to, without further ado, well, maybe one more minute. For those of you that are new to K12 Insight and have not previously heard of Let's Talk, Kelly's going to be referencing Let's Talk in her presentation as one of the components that they have implemented and rolled out at Temecula Valley to help with some of the issues that we're having with mental health. And so just a quick little rundown here of what Let's Talk is. It's a streamlined inbox that helps bring all communications from multiple access or entry points together to provide visibility and real-time stakeholder input and feedback. It incorporates aspects in there of translation so that we can work with equity and access of families that maybe English is not their first or most comfortable language. And it also integrates with critical alerts and notifications so that in an area like something as sensitive as this around mental health and suicide prevention, we can incorporate some of those alerts into the communication that comes in to make sure that the right parties are getting that real-time notification and can do something that actually impacts and creates a better outcome. So that's just a quick little what it is as she's talking through that. And I will turn it over to Kelly so that she could share a little bit about what she's doing in Temecula Valley. For those of you that aren't familiar with Temecula, it's in the sunny state of California, where I am also located as well. So Kelly and I are practically neighbors. But Kelly, over to you to give us a little bit about the journey that you've taken and a little bit about our topic today.
So thank you, Melissa, and thank you, Let's Talk, for having us, be here today, and to all of the participants. As was shared, I'm the Assistant Director for Student Welfare and Success in Temecula Valley Unified. We have just over 27,000 students, and we are supporting them over 28 school sites. So within our department, we support students in their entirety. So we support with behavior, attendance, enrollment, health services. We manage the social emotional team. Basically, student welfare and success a lot of times is equated to a child welfare and attendance office. We broadened that because we wanted there to be a much bigger impact on student support and really looking at the whole child. And so our department supports all things students, accept curriculum and instruction. As far as me personally, I started my teaching career in Atlanta, Georgia with Teach for America. And throughout my time teaching, I've taught all of the grades, PK, kinder through 6th grade, both general and special education. When I left the classroom, I became an elementary school principal, and I served as an elementary principal for 8 years before I took this job in the district office. Within Student Welfare and Success, as I said, we support sites. So I support middle and elementary sites when it comes to behavior, incidents of concern. But the biggest responsibility, and really the most important one I have, is managing the social emotional team in TVUSD. And our team is comprised of social workers, licensed clinical social workers, and counselors who work directly at our school sites to support them in social emotional health. So we support with tier 1 interventions, those whole school models to help develop character and community on our campuses. And our SEL team also supports with tier 2 interventions. So students that are engaged in crisis, students that have trauma in their background, students that just need support being successful in the educational environment. That is our main function on the SEL team, to help them be successful students, knowing that our mental health, our social emotional health, is the greatest indicator of student success. If we're not able to be present in the moment, then it's really challenging to do that work or behave. So that's really been a major focus for our department and something that I get to spend a lot of time working through.
Okay, and Kelly, as you were sharing that, I was just kind of taking in that the student welfare team is broad. It encompasses a lot of sub teams and a lot to coordinate for a lot of grade levels. Could you share a little bit about how Let's Talk? I just kind of ran through the basics of it, but how specifically has it helped you in managing that broad team with all of those components that you just mentioned?
Yeah, definitely. When we first implemented Let's Talk, there were 2 main functions. Really, our superintendent at that time was looking for an additional arm for community engagement. So how do we gather information and really hear from the important participants in our community to understand what they're thinking, what's going on, and really have a better pulse on the trends and patterns that are occurring within our district. So Let's Talk was implemented to support bullying, our bullying campaign, as well as to gather feedback for our local control accountability plan. So in California, we call it our LCAP, which is supplemental funding that our district receives based on our students who are foster youth, homeless, Title I, socioeconomically disadvantaged. And so we were looking for information and feedback to better support the programs within our district.
So you were seeking out that information to come in and not pushing the information out wasn't the focus is kind of what I took away from there. And then I'm also jotting down a few notes as you're chatting. You indicated that you started with your bullying campaign program, or anti-bullying campaign program, I should say, and your LCAP, getting feedback for your funding and your local accountability program. And that allowed you to ingest different pieces of communication from different stakeholders, both student level and beyond. What did you have before that? And how did you manage things like anti-bullying or LCAP or any feedback for a bond or whatever it was that was the important thing at the moment? What did you do before Let's Talk?
So I think just like most districts, we were relying entirely on people coming to us, right? So with 27 school sites at that time, we're at 28 this year, it was 27 different kingdoms, right? That were run by the principal at that site and the team that was there. And in Temecula Valley, there's always been autonomy at our school sites to really respond to your communities. And so each principal has that authority to implement district initiatives alongside what's best for your school, your students, and your community. So you can imagine with 27 different entities, there were a lot of inconsistencies, not through people not responding, but also just handling it in the moment. So we relied entirely on people coming to us through phone calls, emails, or just walking into our offices. That same thing happens here at the district office where someone just kind of supersedes the school site and comes right to us. But also that's limited, right? So we're relying entirely on them coming to us, but within our normal work hours, 8 to 5, 8 to 4, whenever the school is open, or, do they have the right email address? Do they have the right number? And then that often doesn't help because people want a more immediate response. And so we were just challenged by the systems we had in place. And we also realized that those 3 methods of communication, phone, email, and just coming in, weren't necessarily reaching our entire population. There's some people that wanted to communicate a little bit differently, and we just needed another branch, another way for us to gather feedback to broaden our understanding of where our community was coming from.
No, that makes a lot of sense. So it also going from kind of getting filtered information that made its way to you, maybe sometimes, to getting a more proactive handle on a centralized place for that feedback to come in so that you could digest it appropriately real time.
And that's definitely what Let's Talk has done for us. When you think about that, just referring back to the 27 different entities, and everyone is handling it a little bit differently, and people are looped in as they need to be looped in, right? But we also have this need to be consistent. We are a unified school district, and we want to ensure that a middle schooler at one school is getting the same support as a middle schooler at another school. And that really shouldn't be school specific. It should be a part of who TVUSD is. And so Let's Talk has really given us a funnel, if you want to call it that, or even just a platform for having all of these concerns, reports come into one place, and then we can assign them to the people that need them. But also there is an auxiliary group that has an understanding of what's going on at different sites by seeing the reports to really look for trends and patterns. What is a consistent concern across a single campus or across multiple campuses? With 17 elementary schools, if it's just happening at one place, we know how to handle it. If it's happening at 3 or 4 places, they don't know it's happening at 3 or 4 places, but Let's Talk allows us to.
No, and I love what I heard in that it didn't matter what school you went to. So, you couldn't get that, like, oh, you're at the good school, you're at the school that gets all the resources. So it kind of levels the playing field, and it provides that equitable based on needs-based, and then allows you to pinpoint that if there is a need that has surfaced over and over and over again in one place, there's a different way to handle that than if it's in multiple places. And that might be an issue of how you allocate those resources then, instead of kind of fixing the root problem in one particular area. I love that. And I would really be interested at this point, and this is where I think our other poll is going to tie in nicely, is to hear how districts that are on with us today, how they are managing, if they already have a way, whether it's Let's Talk or some other solution, to start to centralize and manage this so that they have the visibility across the board for real-time support for mental health, specifically for any mental health outreach. And we put together a couple in the poll of known entities that we know are out there that some districts are using, sometimes in tandem with Let's Talk, sometimes standalone. And then we couldn't, of course, get them all. So there's a nice spot there for other, if it is not one of those that we rounded up. But just take 30 seconds to tell us if you are, in fact, using something. If you're not sure, and other could be a whole host of things, like maybe it still is email or visits, and just take about 2 more seconds to answer that poll, and that'll give us a good idea of where everybody's at. Okay, I think that's about time on the poll. And what do we have here? So we have a mix on this one, and it looks like we have some anonymous alert, no, Google Forms, and not sure, other. So, I mean, it really is a big mix across the board in terms of what's being used right now. The not sure, other are interesting. If you did select other, if you wouldn't mind just popping into the chat what that other is that you use, that would be helpful for us as well as we steer and navigate this conversation. And for those of you that are using something beyond just email or the filtered, somebody came to you and let you know that they heard that this was happening, long tail, then that is great that there's already some solution in place to help with the growing numbers that we're seeing with students that need support. But do take a second to pop in the chat if you selected other, what that other is. And the fact that several, it wasn't the number one, but it was up there in the mix of participants on the webinar, indicated that they were using anonymous reporting as a function or as a platform. I just want to take a minute, Kelly, and talk about anonymous reporting as a feature. So not to be confused with the platform, but within Let's Talk, the anonymous reporting feature is one of the things that you've paired together with some of your initiatives around mental health. And it could be, in many cases, there's like two sides of the coin on whether or not anonymous reporting is good or whether or not allowing anonymous reporting creates more issues. And so I wanted to just open up that semi-controversial topic and see how you've handled the anonymous reporting aspect of it, because it is a feature that's allowed in Let's Talk, and what you've seen from like real-time use.
Absolutely. Anonymous reporting is definitely a double-edged sword, right? Like there are really great things about it and really challenging things. The great thing about anonymous reporting is that sometimes people just need to vent, right? They just want to share their concern and let it be heard. And we can hear those concerns. And again, looking for trends and patterns. Most anonymous reporters don't want a response. They report it anonymously for a reason. In Let's Talk, if they provide their contact information, we can still respond to an anonymous report. That's nice. And we always respond when we're able to. Sometimes an anonymous report is someone that's fearful for retribution. You know, they are reporting something that they don't want people to know they're reporting because they are scared that their child will be bullied as a result of their report, or there will be some negative circumstance that comes out of them having made the report. We got a lot of anonymous reports during the time of COVID, people that were COVID positive that weren't telling, and that's fantastic. Thank you for letting us know. But the part about anonymous reporting that is amazing is when an anonymous report is made about a student in crisis or a potential school threat of violence, the information is critical and it allows us to respond immediately. So when those anonymous reports come in and we pair it with that critical alert. So the critical alert comes as part of keywords within the anonymous report that immediately, show red flags, then we're able to jump right into those reports and say, okay, what exactly is being reported? Who is the student? What school do they go to? Let's contact the school. If those reports are coming in after hours and it is a report of suicidality or a school threat, we can immediately loop in law enforcement. And in all of these circumstances, even though the report came in anonymously, we can still respond. And most of the time, it is something that needs to be responded to. As with all anonymous reports, as I said at the beginning, we get our fair share that are just someone venting. And that is fantastic. We want people to be able to share their opinion and have a venue for that. Everyone is entitled to share those opinions and to be heard. And it gives us that platform, but it also allows us to respond to a crisis that may not have been responded to otherwise, which saves lives, just to be very blunt about it. And that is something that it's worth it. It's worth sifting through those other anonymous reports, or even just, we also get our fair share of anonymous reports that are not substantiated, or we can't follow up on them because the report is too vague. That just happens sometimes, and we're getting better at weeding those out and really figuring out, okay, let's call the school. Is this something that is factual or not? And a school can say, oh no, I dealt with that the other day. It's this, this, and this, because they already have boots on the ground and they know exactly what's going on. And so we can, catalog that report accordingly. That is a part of this as well. And then, like I said, there are those other ones that we received a report and it was the first name of a student and they were having trouble at lunch. Our smallest campus has 600 students on it. So if you give us the first name, John, and John's having a problem at lunch, or Sarah or Jose or Marco, we can't always figure out. And that's a multi-hour campaign to try and isolate one student out of 1,000 or 3,000 on our high schools who is having trouble at lunch. So those things do happen too. And like I said, we're getting better at weeding out the ones that we cannot respond to just because not enough information is there. But again, it's worth the time to do those when you know the other anonymous reports that you've received that are about suicidality or threat assessments are imminently important. Like we have to do something about those. So it's give and take, but in my opinion, it's worth what we get.
For sure. If you can get just one of those that wouldn't have come in and that now they feel like there's an avenue or a path forward or a place that they can go. You can't put a value on that life. As you were talking though about the one example where maybe there was a student first name only having issues at lunch, it made me think about the nice thing about the anonymous reporting is even though they can report and choose to stay anonymous, you still have the ability to dialogue with them back and forth. So maybe they don't want to disclose who they are, or they haven't given you enough information, but now there's a connection point made through Let's Talk where you could see if you could elicit more information or let them know that you do want to help, but you need a little bit more information, not necessarily, full disclosure of all information, but to help weigh in. And I'm assuming that happens as well.
It absolutely does. And it's something that, because we just talked about Let's Talk the other day and different platforms and ways to go about this. Google Forms, for example, you can turn it in or you can adjust that form so that people don't have to identify who they are to respond, but there is no way to respond back to them or to gather more information if it's necessary. Let's Talk can do that. And I think that's the other part that sets it apart from some of our other maybe free platforms or things that we can do is yes, we can set up a Google form and we can gather information. That's what Let's Talk does. But this anonymous reporting piece of it that still provides confidentiality to the user or to the reporter, but allows us also to still gather information if we're able to, is critical and it helps. It doesn't always work out because people don't always give information in order to be responded back to, but at least we can attempt to respond back and gather that information and know that we've seen that concern through to as far as we can take it. And even in that example of a student named Marco having problems at lunch, that is information that's important for the site too, because now they know there's something happening at lunchtime. They may not know who, they may not know when, but we can put some extra eyes out there. We can see, put your ears to the ground. Like, is there something that's happening? Tell your campus supervisors or your teachers on duty or whatever staff are there, just keep an eye out. See if there's something going on so we can identify, just even based on the smallest piece of information, a trend or a pattern or a concern that might be arising on our campus that we just didn't hear about otherwise.
Right. And another data point. And I love that you can, how you illustrated, it's not the end, just because the report comes in, it doesn't stop there. You're able to two-way dialogue. And I think that prompted a question over in the Q&A section. So I'm going to go ahead and read this one to you, Kelly. It says, in what ways do you utilize the tool for suicide prevention versus how does it look similar or different in bullying prevention? So both, one could be a precursor to the other, but the specifics is in the platform itself, like how do you differentiate and what's the same about how you handle those?
Okay. So we have two different buttons for reporting. So all of our bullying reports go through one channel, if you want to call it that, that is specific to our sites. So when a bullying report comes in for Vail Elementary School, it goes directly to that site principal. The ones that come in for suicide, suicidal ideation or self-harm come through a separate button that goes to our district crisis team. So our district crisis team is represented by the coordinator of behavioral health, as well as the members of my team here in Student Welfare and Success, and the assistant superintendent for student support services. So the 5 of us receive all of those reports that come in for suicide prevention, so that the fastest response. So we know when one of those reports comes in, we have to be at the ready because we employ different staff to respond to those concerns than we might if it was a bullying. So bullying is generally site specific and it's circumstantial. And so it is appropriate for those reports to go straight to the school site first, because if it comes to the district, that's what I'm going to do. I'm going to pass it back to the site to manage it. Whereas the suicide ones really do need a more global response. We want our social emotional team to tap in. We need to decide if it's a threat assessment that needs to be conducted, which we do every single time. We need to decide if that student is going to be put on a 5150 hold. We may need to contact law enforcement to have somebody go out to the house immediately if it's not during school hours. So it just triggers a different team based on where the reports come in. And then our response is, of course, appropriate to the report itself and what staff we need to be out there to manage a situation.
No, that makes a lot of sense with, routing it either locally or more globally. And since I happen to be a Let's Talk user, I do know that if something comes in through the wrong channel, the wrong button, the wrong access point, you can easily route it over behind the scenes. The student, the staff member, they don't even need to know that any handling happened, and they can get one of those actions that you just outlined without.
And Melissa, that happens all the time, right? I think there's 3 to 5 times a week that a report comes in and I am routing it to somebody else. I'm routing it to the school site, or I'm routing it to a district staff member, or someone else who is the immediate, like the first responder to that particular concern. And that's always what we want to do. In a district as large as ours, we have teams that are on site in order to respond to these reports efficiently and expeditiously, right? That's what we want. And so we get incorrect reports, but the reroute is so easy. All I have to do is my partner, Jess Caponegro, and it'll go right over to him. So it's definitely an easy reroute that happens within seconds in the platform.
And an easy reroute, not to be like mistaken with an email forward where it's just sent off and like, we hope they deal with it, but it stays in your visibility so that you know how it's handled until its final execution, and can see how long that took and what the actions were around that. So that visibility is not one of just rerouting and passing it off, but rerouting to make sure that it is handled in the most effective way possible with that service provided if one was needed.
And that has taken our team some time, because when you're in the platform and I reroute it to somebody, I'm still on it. If I change the owner and that person is the person responsible, that's great. But then we're always putting notes in there. So I just sent one to a site principal this morning. Can you please follow up on this? Let me know if you need any support. That's all tagged and timestamped within the Let's Talk platform. So the concern or the report is not closed until we know that there's been a conclusion. So it helps us with responding to the situation, which is our priority, but also documenting what we did. So if there's any point where any of our reports come back as what did we do, who responded, if it comes through Let's Talk, it allows us that opportunity to go back and look at who is it routed to, what did they do, what was the conversation that was had, and it just really memorializes that response in the event that we need to research back to it, or like I talked about earlier, patterns and trends. If we have routine reporters and we are looking at, okay, what are the concerns that they have? It just helps us to catalog those and see where might we have some bigger issues that we need to manage.
Yeah, it really gives you that documentation in one place and not having to go to many different buckets. I see that Donald put an interesting question in this case in the chat, and it's out to all participants. So if you haven't seen it, participants, take a look, because I think this will be one that we'll circle back to in a few minutes, but it will be nice to see how you respond, because this is one that is universal, regardless if you have Let's Talk or anything else, it will work. So since we know that there's a variety of different platforms and methods being used, take a look at his question. We're going to come back to it in just a minute. It's like almost like a real live time poll. So thank you for that, Donald. And while people are thinking about that, I wanted to just kind of end with a program that I know that you've had in place. It's one that I know our team is working on writing up a case study about. It kind of ties into everything we talked about, and it is where you started this this webinar. How did you get started with Let's Talk? And it's one that's been successful, so it's continued to grow and promote. And it's specifically it's your Because Nice Matters program. Kind of the entry point into Let's Talk, and it sounds like it just evolved into so much more. But if you could tell us a little bit about that getting started, and I think this ties into a bit of what Donald's asking too, and they're going to kind of layer on to one another. How did you get started with that? You know, what are some of the reasons on why it's been so successful and why it's still running? And just, you know, give us a sneak peek into the behind the scenes on how to get everybody rowing into, you know, they know where to go and they know how to access, in this case, bullying help, or how do you get them all on the same page when you have all these students, all these families? And I think Because Nice Matters is a good example. It's continued on for many years.
Absolutely. So I think our district isn't special, right? That we deal with bullying the same as everybody else. It's on every campus. It's happening, and we are looking for ways to educate students and staff about what it is, how to identify it, how to prevent it. And there are so many campaigns that are about what you should not do. And we were really looking for something about what you should do. So back in 2012, the district implemented Because Nice Matters, and it is an entire week devoted to kindness and how can we treat each other in a way that we want to be treated. What can you do to show kindness to each other, to the entire school community? And it's implemented at each site uniquely. So the week is consistent across the school district, but then each site determines over the course of the week how they would like to celebrate. So it is usually accompanied by Crazy Hair Day or Wild Sock Day, and a slogan to go with that. You know, we talk about when you are just a regular person, you have a blank slate. There's no harm that's caused, but every time you're bullying or bullied, it's almost as if you get a bruise on your psyche or on your heart. And that really is, it goes into this idea of purple and blue. And, you know, there's a day that you wear white because you have that blank slate, and there's a day that you wear purple to really signify and say, this is what it feels like when people bully me. I feel bruised and I feel hurt by how people are treating me. And so the entire campaign is really focused on kindness. And what can you do? We all make mistakes. Everybody says something unkind at one point in their life. That's just part of being a human. So how can you rectify that concern? How can you be the type of person who builds people up instead of breaking people down? And what are the ways that you can be nice to your classmates, nice to your family? How can you show kindness to your school? And I remember during campaigns when I was a principal, we talked about showing kindness to our school community. We pick up when there's trash on the ground. It's not because it's yours, it's because that's the nice thing to do and the right thing to do. And so when that, like I said, that started about 2012. And then in 2017, looking at adding the reporting bullying platform through Let's Talk, because a lot of times with bullying, like many other things, people don't want to report. I think for those of us that grew up in a different time, we are used to the school experience is defined as having been bullied at one time or another. I think if you ask any person of my age group, middle school is an awful time, right? It is a time where you're developmentally trying to figure yourself out, and somebody is going to pick on you, and that's just a part of growing up. You're going to get pushed down, or your friend group is going to leave you, but these are unkind things. And so how can we shift that? How can we say that nobody should have to have a negative school experience, and that shouldn't be the norm? The norm should be for everybody to have a positive school experience. And that starts with kindness. And that starts with being nice, because ultimately being nice matters. And what's really cool is that the city of Temecula actually had a state of the city address, which includes Temecula has heart because nice matters. So it's really something that our entire community has embraced, and something that we're really looking forward to bringing back in full force as we open next school year, post-pandemic or in this endemic phase. because the opportunities to have these conscious conversations with kids about how you behave, how we treat each other. I think it kind of goes to Donald's question as well with how are we engaging with one another on social media? There's a lot of keyboard courage that exists because you don't have to say something to somebody's face, but that's also unkind and not the way we want to be treating each other. So the campaign is evolving along with the day and time that we live in, but ultimately that foundation for why we do it is the same. And it's just helping kids to understand how that fits into the context of their lives now. And Let's Talk, that bullying platform, just gives a voice. So a voice to a student who's being bullied, a voice to a bystander who is seeing bullying and doesn't know what to do about it, a voice to a parent who's hearing their student talk about these things, but maybe really doesn't know how to address that at the school, or what to do about it, or for somebody who feels like they're being bullied and they've told their teacher or they've told the principal and doesn't feel like anything's being done about it. It's another way to engage in that conversation to help just bring in everyone so that we can address the concern.
So that has led to another question. And I think this is great. So Donald, thank you for starting this line. This is what makes it good when we have the interaction here. So along those same lines, sometimes students are hesitant to submit reports because it may feel like tattling. And how have your students responded to using Let's Talk, or how has your messaging around that helped to support them get away from that mentality of tattling?
Well, to be honest, it's the anonymous reporting feature, because anyone can make a report, and we tell everyone, see something, say something, right? You have to make these reports because we do follow up on every single report. If you are worried about some sort of fallout from making the report, that's okay. You can make the anonymous report so that we know that it's happening. We also have students that will report and ask that you don't tell them that I told. And so that is a great opportunity for us to have a conversation with that student and really help them to identify, when you advocate for yourself, that is how you stand up for yourself. It's not about using our fists or negative words towards another person, but you're asking to be treated in a way that you deserve to be treated. There are always going to be people that don't want to report for a variety of reasons, but I think anonymous reporting helps to protect the reporter and also to alert us to these situations that may be occurring. As I referenced earlier, when you're looking at patterns and trends, if the same site is having reports of bullying every day at between second and third period, then we know exactly where the problem exists and we can catch them in the act, which is very helpful. It's always great to have that firsthand experience. I see it, I can do something about it, as opposed to relying entirely on reporters, even if it came from a report in the first place.
Right. No, that makes a lot of sense. And so if I could just paraphrase back, I think everything that you just said in the question Donald asked, and there's been some chat going on in the sidebar too. And how do you get that message out? It's you talk to the students at their language and bring them programs that are relevant to kind of meet them where they're at, whichever grade level they're in. I heard that you're partnering with outside entities too, so they're not just hearing this while they're in school, but they're hearing it across the board. And then you had indicated earlier that you sometimes get things that come to the wrong area in the wrong place, and it's easy to send it to the right place. So that also tells me that you're working across departments. So it's not just your department that's carrying that mantle, but it's more of a global experience there at Temecula Valley on how to get something in to get a response. And those three things: communicate often at the level, make sure it's beyond just within the school bell time frame, and the third one there, working across departments. It's not just the one department. Where the three nuggets that I think back over to Donald, regardless what platform you're in, those three would apply to any platform to make sure you're getting the most and maximizing the most use and capturing the widest audience that may be in need. Anything else you would add to that I might have missed?
I think there was a question in the chat about how do we let people know about Let's Talk? Initially, the mode of communication was just word of mouth. It was posted on the website. So there is a button on every single district and site website for reporting, so that people know, and it's right at the banner. It's one of the main buttons on every single website for reporting concerns. So whether you're reporting bullying, you're reporting suicidality or something else, there is that click, easy click. We also have it available on, in our site newsletters. Every site sends out a newsletter or some sort of publication weekly. And then it is most often talked about and during Because Nice Matters Week as another means for reporting. And it comes up in casual conversation. So if a student is sharing a concern, it is something that you can always report that through Let's Talk. It's something that we give them as a means to do. It doesn't always go that way though, because if you're already at a site and you're telling me about a concern, I've heard it. You don't have to report it through Let's Talk too. Its main function is for outside of hours reporting, or like I said, those special circumstances where a student does not feel comfortable, or even a parent doesn't feel comfortable reporting directly to the site, or just isn't available during those school hours to call and doesn't want to email. So it's used more in that regard, because ultimately we want students to come to us first. It is most important that they feel they have someone on their campus that is available to help them stay safe and participate at school. So it's not our primary go-to, it's our secondary response for those who feel that they can't go to a staff member or administrator on a campus.
And you may not have realized it, but as you were talking, you answered a question almost real time as it came in about after hours reporting. So that was just perfect and serendipitous there. I will put out a call for any last minute chats, questions while we have Kelly. Kelly, this has been such a good taking us from the start to where you are now and all the places in between on how that you have with your team supported mental health, with Let's Talk as one of those tools. So we've covered a lot of ground here. So I do just want to give everybody a minute to see if they had another question or anything else that they wanted to comment. And yes, we will indeed send the recording of this session and probably a few little goodies that popped up in the chat as well, so that you have those as reference. So check on that. And then there is a question, and this is about buy-in. So thank you, Robin, for sending this over. Have you run into any issues with staff buy-in with the tool? I know that some adults worry that false claims may be submitted. And this is kind of that double-edged sword we talked about. Anonymous reporting touches on that. It's not the only way a false claim could be supported or submitted. But share your experience with, how you've handled that, or if you've run into that with the group.
At this point, I don't have on the top of my mind, even as a principal and teacher in district, having been a part of a discussion about that concern. I think, like you said, anyone can make a false report about anyone at any given time. We work really hard to investigate the concerns that come in and to not make rash decisions about what may or may not have occurred based on the report. So we go in with a skeptical eye on almost every report, trying to pull out what are the important details, what are the critical pieces of information that are necessary, and then we ask a lot of questions. And we work to investigate fully before we make a decision, whether it's related to discipline, something that's going to go to human resources, something that's a big concern. We work really hard to say, okay, well, we've heard it one time. There are 27,000 students. Is that a significant concern, or is that just this one situation? Because we know there's always going to be people or families or community members who are struggling with something, a decision that we've made for one reason or another. So we try very hard to be that kind of response team, the kind of response team that's thoughtful, that authenticates reports when they come in and asks questions before we make judgments. And I think so it's not so much about the platform, but in how we respond to reports when they come in, and just being the kind of team that you want to be a part of.
Well, and I think a false claim could be submitted whether you have a platform or not.
Absolutely.
This way it helps kind of centralize the data. I always go back to data on where those are coming in, how they're coming in, what they're coming in for. And you can go back and take a reflective look really easily with one of the dashboards or one of the reports on that. Thank you, Robin. Robin gave you a thumbs up on that answer.
Thank you, Robin.
Okay, and I didn't see any other questions come in. And so I am going to pop up if you do want to continue this conversation, because it is an important one. And if you had indicated that maybe you didn't have something that you were working with or that was working for you to help support in this area of mental health and well-being, I am going to put my contact information up on the screen, and I can help be a conduit for that, whether it's more questions for Kelly or other questions about, any other districts or anything that's relevant. You can absolutely reach out to me, and I can help make sure that I facilitate, any other resources or next steps for you. And so that is up there. I'm Melissa. I think I introduced myself in the beginning. I work with our client success team as get to work with all of our many clients across the nation. We have a lot of examples. I too was a former educator, so this is something that's near and dear to my heart, having been in public education for 11 years and having seen a lot of these situations. So I'm a big fan of not reinventing the wheel, taking something that's working, whether it's working in California or New York or Florida, and helping bring that together to help students and families ultimately, be all that they can be in the top of their game, so that they can not only achieve in life, but also this leads to academic excellence and excelling too, which could be a whole other topic on how they relate. But Kelly, I thank you so much for joining and really just kind of walking us through the journey of one district and how it's evolved. And thank you for all the work that you've done and put into, really helping students. It's not an easy job and where you're at. And I think you have the background and having worked with all the grade levels that you have to oversee this charge. So thank you again.
Thank you again for having me. I hope that this webinar has provided some insight and information to people as we look forward, because the most important thing is to support students in the best way we can. And if this is something that works for you to support students in your district or on your campuses, that's what we're all for. That's what we're all about.
Agree. Okay, thank you, Kelly. Thank you, everybody, for joining, and be on the lookout for that recording. We mentioned it would come out earlier, and do pass it along and feel free to share it with anybody that couldn't join as well. Thank you so much.